So hey guys, hello and welcome to my YouTube channel once again. As you already know that in our previous videos we talked about the gallstones and how they are formed and what are the bilirubin gallstones or the pigment gallstones and what are the cholesterol gallstones. Now in this video we have to proceed in such a manner that we have to learn all the gallbladder pathologies which can arise due to those nasty stones. So these are the stones and what are the pathologies that may arise due to these stones. Now there are various pathologies that can arise like the biliary colic and like we have the acute cholecystitis. So I am so sorry about my handwriting, but you have to compromise on that thing. Chronic cholecystitis, okay, gallstone ileus, ascending cholangitis, and finally gallbladder carcinoma. Now in this video we'll primarily learn about biliary colic and acute cholecystitis, and in the upcoming videos we'll talk about chronic cholecystitis, gallstone ileus, ascending cholangitis, and gallbladder carcinoma. So let's first talk about what is biliary colic and what is the situation with acute cholecystitis. Now first of all we'll talk about the biliary colic. So let us suppose that this is the GB. So obviously this is the cystic duct and this is the common bile duct. Okay. Now what happens over there is that in case of biliary colic there is a gallstone. I told you that the cholesterol stones are the most common stones and they are radiolucent and they are yellowish in color. So let us assume that this is a gallstone which has got stuck in the cystic duct. Now what would happen is that when the person will have a fatty meal, okay, now in response to the fatty meal always remember that there is a release of cholecystokinin and cholecystokinin causes the contraction in the GB. Now as a result of the contraction in the GB there will be contraction against an obstruction, and whenever there is a contraction against obstruction it results in a pain. So this pain is called as biliary colic because it is arising from the biliary tract and it is colicky in nature, like raising in intensity and decreasing. That is why it is called as biliary colic. Now as the stone dislodges, let's assume that the stone it again passes into the GB or it passes down, the biliary colic will resolve. So the idea is that biliary colic is nothing, it is a waxing and waning pain in the right upper quadrant which occurs especially after the fatty meal, and it is due to the lodgement of the stone in the cystic duct which obstructs the flow of the bile following the stimulation by the cholecystokinin. Now this brings us to the most important concept, which is the acute cholecystitis. Now if we ask about acute cholecystitis, as such there are no questions regarding the acute cholecystitis, but yes, acute cholecystitis presentation and your recognition of acute cholecystitis is very important. Now see guys, wherever there is itis, it refers to the inflammation. And inflammation as such it doesn't occur on its own. First of all it requires a trigger, let's say infection, and this infection will trigger the inflammation over there. Now what is the idea of acute cholecystitis, like how does acute cholecystitis occur? So let's assume that this is the GB, this is the cystic duct, and this is the CBD. Now what happens over there is that there is the lodgement of the stone in the cystic duct. As a result of the lodgement of the stone in the cystic duct, there will be accumulation of the bile in the GB itself, and this bile it will cause pressure on the walls of the GB. As a result of the pressure on the walls of the GB, there is a phenomena which is called as pressure ischemia. So there will be something which is called as pressure ischemia. So there will be something which is called as pressure ischemia, that is ischemia or low blood supply because of the pressure. So there is something which is called as pressure ischemia, and as a result of pressure ischemia there will be weakness in the wall, and there will be weakness in the wall as a result of which the bacteria or the other pathogens, they can easily penetrate in the wall, and as a result of the penetration of those bugs into the wall, there will be something which is called as the infection. And as a result of the infection, there will be inflammation, and this inflammation is called as acute cholecystitis. Now this is the whole pathophysiology of acute cholecystitis, and I will request you to always remember the pathologies, like how the things are taking on at the very first place, and after that you just go and study what is the presentation and stuff like that. Now if we talk about the clinical feature or the presentation, first of all, there will be pain in the right upper quadrant, because the GB is located in the right upper quadrant. There will be fever, because whenever there is systemic infection and inflammation, there is fever because of the release of various chemical mediators like interleukin 1, interleukin 6. There will be something which is called as leukocytosis. Again, whenever there is systemic infection, there is elevation in the WBC count, which is called as leukocytosis. There is something which is called as Murphy's sign. Now I will ask you to pay a little bit attention in the Murphy's sign. What happens in the Murphy's sign is that when we when we poke our fingers into this costal margin, right upper quadrant costal margin, and ask the patient to breathe, there is something which is called as inspiratory arrest. And the basic idea is that whenever we are eliciting this sign, in case of inspiration, as the diaphragm it moves down, the GB or the liver is pushed against our fingers, and as a result of the GB being inflamed, there is intense pain, and this causes the inspiratory arrest. So this is the whole idea regarding the Murphy's sign, what Murphy's sign is and how it is found in case of the acute cholecystitis. So these are the main clinical features of the acute cholecystitis. Again, right upper quadrant pain, fever, Murphy's sign positive, and stuff like that. Now, what is the complication and what is the management and what are the other findings which are associated with acute cholecystitis? First of all, we'll always remember that in case of acute cholecystitis, the alkaline phosphatase is elevated. Now, what is the idea of that alkaline phosphatase and why it is important? See guys, this ductal epithelium, whenever it gets damaged, be it cystic duct, be it CBD, whenever it gets damaged, the ALP is raised. So in case of obstructive jaundice, it is raised. In case of cholangitis, it is raised. In all the cases where there is damage to the ductal system, the alkaline phosphatase is elevated. So is the scenario with with this thing. So alkaline phosphatase is elevated, number one thing. Another thing that occurs over there is that in case of acute cholecystitis, the major complication is that there can occur the rupture of GB. Regarding the treatment is always cholecystectomy. For example, if the person is coming to you with acute cholecystitis, you have to stabilize the patient and you have to take the patient for acute cholecystectomy, emergency cholecystectomy, because the GB might rupture. So this was the whole idea regarding the acute cholecystitis. In the subsequent videos, we'll talk about what is the chronic cholecystitis, what is porcelain GB, and what are the other complications regarding the gallstones.